Pregnancy bleeding. Pregnancy bleeding is a relatively common issue that a pregnant woman may face and cause anxiety, especially if the bleeding is at the beginning of a pregnancy and is called spotting, that is, when the fetus implanted into the uterine wall, or the bleeding was during the last months of pregnancy. The amount of bleeding varies from a few drops to severe bleeding. When does pregnancy bleeding occur? During the first 3 months of abortion. It is the end of pregnancy before the 14th week of pregnancy, and it is considered a common thing during the first trimester of pregnancy, and most abortions occur early in pregnancy as a result of the presence of genetic diseases in the formation of the fetus, hormonal disorder or thrombosis, blood or defects in the womb. Ectopic pregnancy. It is considered one of the less common cases compared to abortion, which is the lack of implantation of the fertilized egg in the uterine wall, and its survival in the fallopian tube, which leads to severe pain and bleeding. Clustered pregnancy. It occurs due to the presence of abnormal tissue in the womb and the presence of an unvaccinated egg, which causes bleeding. Pregnancy with twins. The risk of pregnancy bleeding increases when pregnant with twins. Cervical changes, especially when having sexual relations, or as a result of an internal examination, or the presence of fever growths in the cervix. Clustered pregnancy. Clustered pregnancy occurs when the placenta develops abnormally into a group of accumulated cysts similar to grape clusters, and leads to high blood pressure, increased uterine growth, preeclampsia, anemia, ovarian cysts, and hypothyroidism, which requires termination of pregnancy and treatment. Second and third trimesters of pregnancy. Vaginal infections. The risk of bleeding increases in the second and third trimesters of pregnancy when vaginal infections are present during this period. The sign. It occurs late in pregnancy, and is in the form of a small amount of blood mixed with mucus, and occurs as a result of the exit of the mucus plug that formed in the cervix during pregnancy, and is considered as a sign of a change in the cervix and its readiness to enter the labor stage. Placenta separation. It is considered a very serious condition, which occurs as a result of the placenta moving away from the uterine wall, due to malnutrition, anemia and high blood pressure. Aplastic placenta. It is considered one of the rare cases in which the placenta is low and in contact with the lower part of the uterus. Advanced vessels are rare cases, and occur when the blood vessels of the fetus enter the membranes covering the cervix, and when these membranes are torn, the vessels are torn and vaginal bleeding occurs. Uterine explosion, where the uterus opens and expels the fetus out. Symptoms of pregnancy bleeding. Severe stomach cramps. Very dark blood color. Severe pain in the lower abdomen and cramps. Acute pain concentrated on the left or right side, where it indicates pregnancy outside the womb. Diagnosing the cause of pregnancy bleeding. The cause is diagnosed through a vaginal or pelvic examination, blood tests to check the level of the pregnancy hormone, and ultrasound imaging. The symptoms accompanying the bleeding are also diagnosed, including pain, dizziness, cramps, blood color, quantity, and intensity of blood. Treatment of pregnancy bleeding is performed an ultrasound examination to confirm the position and condition of the fetus, to take the necessary precautions, and in most cases the pregnant doctor is advised to rest and stay in bed to relieve pressure and lift it from the cervix and help the blood to flow to the fetus.